look forward to the opportunity to providing you with an update on the progress that Milo has made over the past 6 months since his surgery back in January. Very special welcome to the media that have joined us today. Jenny Hayes from Oliver and Friends Farm Sanctuary, who has adopted Milo. Dr. Summer Higley, 2009 alumni from Oklahoma State University. Dr. Jeff Studer, who is the director of our teaching hospital at Oklahoma State University. Dr. Eric Clary, who is Milo's surgeon, veterinary surgeon. And also joining us is Dr. Dan Burba, that is the head of the Department of Clinical Sciences in our college. You know, Milo is a story about compassion. It's a story that tells the collaborative effort of our talented faculty, staff, students, and residents in providing excellent veterinary care to improve the quality of life of our beloved pets. It is also a story that tells the impact that veterinarians make to strengthen the human-animal bond that improves the well-being of both the pet and the owner. And I want to thank the media for sharing this story to many, not only in the United States, but also abroad. So at this time, it is my pleasure to welcome Dr. Jeff Studer, who's our director of our teaching hospital.
Thank you, Dr. Risco. Good morning and welcome, and thank you for coming today. We're very excited to share the success story of Milo, our now famous and beloved patient at Oklahoma State. Milo is a great example of the many success stories that happen inside the OSU Veterinary Medical Teaching Hospital every single day. Our mission at the hospital is to shape the future through discovery, education, and unparalleled veterinary care. And Milo represents just that. He also is a great example of the power of collaborative veterinary care. Milo's medical team consists of board-certified specialists in small animal surgery, radiology, and anesthesia. In addition to those specialists involved in his care were postgraduate veterinary interns and veterinary residents in those same fields, along with veterinary students who will soon be leaving our institution to provide excellent veterinary care across the world. And last, but certainly not least, is the collaborative relationship that we have with our referring veterinarians, like Milo's family veterinarian, Dr. Summer Higley. His impressive caregiver, Jenny Hayes, is really the first step in this collaborative effort, and she's gone to great extents to make sure that Milo had the best success that he could have. And so that collaborative team working together exhibits the power of veterinary specialty medicine today in 2019. So Milo, or Jenny, sorry, when I think of Milo, I think of Jenny. Jenny and Dr. Healy, thank you for entrusting the care of Milo to us at OSU Veterinary Medical Teaching Hospital. So now I'd like to introduce Dr. Eric Clary. He is one of 3 board-certified small animal surgeons at the Oklahoma State University Veterinary Medical Teaching Hospital. Dr. Clary?
Thank you, Dr. Studer. Appreciate it very much. Good morning. Dorinda, if you don't mind. Yeah, thank you so much. First of all, thank you all for being here this morning. I'll start off just by stating the obvious, and Dr. Studer's already alluded to it, but Milo didn't check himself into the clinic. He had somebody not just bring him here, but even before then, Dr. Heatley, I think, recommending that Milo might be served well here. Dr. Heatley, thank you very much for that. But the fact is that the opportunity, the privilege that we have to work with pets at the Veterinary Medical Hospital, it comes simply because folks entrust the care of their pets to us, and so I'm grateful for the opportunity to work with Milo. Certainly Milo's story is well known, but I thought I would just try and give a rundown on some of the medical particulars this morning. And so as an academic, I just can't help but use PowerPoint to do that. I apologize if that just seems a bit out of place for a press conference. But Milo, certainly a most unusual patient. I've been doing surgery since 1992. Milo is the third patient I've seen with the particular condition. Ms. Dorinda, our marketing coordinator, dubbed it as the paws upside down, and I honestly can't think of a better description in the vernacular. And so Milo's issue of paws upside down, well, a lot of times when I talk to people about this, they wonder, well, how on earth can that happen? How does that occur? And so I'd like to just share with you, number one, a little video here, very short clip, just so you can see Milo doing his thing here. And I'm going to go ahead and get us all the way on presentation mode. He's a very hardy creature, no doubt. This is Milo at 7 weeks of age when Miss Jenny brought him to me in early January. You see Milo certainly having challenges ambulating. The best he could muster was what I called kind of an army crawl. What, you know, as a boy we used to play around, kind of crawling around. Well, that's what he could do. But in every other respect, he was just simply trying to be the puppy that he is. So you see him kind of biting on the leash there, and you know, just entertaining. Just a real treasure of a patient. A lot of spirit, a lot of heart, but certainly just very debilitated. And so Miss Jenny brought him in, and basically her question to me was, well, can we do anything about it? And so part of the deal is just to try and understand, well, what exactly was his problem. Again, it's hard for people to understand, well, how on earth can a puppy have paws upside down? The reality is that the problem actually is higher up in his limb. It's in his elbows. Either before birth or shortly after birth, Milo's elbows luxated, went out of joint. And when the elbow is out of joint, then that just allows the whole bottom part of the limb to rotate. And so that's what this little diagram shows. Toby Wilson, a great colleague, graphic designer here at our Center for Teaching and Learning Excellence, he helped put together a little animation here to show. And so it begins with a luxation, or the elbow out of joint, and then that allows the forearm to rotate. And that gets to about 120 degrees, and you get the rest of it just by how Milo's shoulder works out. So when he tries to crawl, that's basically what he's doing. He brings his shoulders out almost like he's super dog, and did the best that he could. But as you could tell, he just really struggled to get where he wanted to be. And so the question, well, what can we do? My experience in now Milo number 3, the 2 dogs I had seen before, one I had an opportunity to operate on. And so I kind of knew the basic technique. Yeah, I went back to the literature like any good surgeon would do to review and say, what's the best approach? But with Milo's treatment, it really was 2-pronged. One was surgery. Really the harder part was what comes after surgery with all of the rehabilitative care. But with respect to his surgery, what we did was we had to go into each joint, make an incision on the side of his elbows to get the bones realigned, and then once we had the bones realigned, then to put a pin across his joint that would hold the joint, hold those bones in alignment. Not a real sturdy repair, and so that's why Milo had to wear this big front body splint. And so you see the picture there with the nice orange splint with Pistol Pete little stickers and all. For 2.5 weeks, that was Milo's life. And I say that's Milo's life. That was Jenny and Jason's life, because a puppy dog wearing a full body splint, not mobile, has to be carried everywhere. One of my favorite pictures of Milo during his early rehab was Milo sitting with Jason on the tractor. Jason's driving the tractor, and Milo's right in between them. Looks like almost like Milo's driving the tractor. They had to take him everywhere. He simply just couldn't be left on his own. And so a lot of care we understood up front. But that's how you protect that repair in his elbow while his body was doing some healing. 2.5 weeks, we were able to remove the splints. We had to remove those pins. and his elbows were nice and stable, and we were very happy about that. But then the real hard work began with the rehabilitative care. Our colleague, Dr. Kara Blake, she's also a surgeon. She's a certified canine rehabilitation therapist. She's working in the clinic today while I get to hang out with you guys today. Well, Dr. Blake put together a rehabilitation protocol for Milo, and they started that the day after pin removal. Milo was in the hospital for a few days. Miss Jenny came up. Dr. Blake showed Jenny how to do certain things at home, but by far the lion's share of the rehabilitation care has happened actually at home. And so Miss Jenny will speak here shortly. She'll, I hope, just give you some clue as to what all was involved from her perspective. But just as in human orthopedics, oftentimes it's the combination of surgery and post-operative rehabilitation that gives the prospects, the greatest prospects for success. I couldn't be more thrilled with Milo's progress. The day after, this is like 3 days after pin removal, before those splints came off, Milo had never stood with his paws right side down. He had never taken steps or anything. He had to be trained how to do even those basic kinds of things. So at 3 days post-op, here we are just kind of giving him a little bit of space to see if he can stand. He's very weak. He's eating peanut butter out of a little Kong toy there. He's a peanut butter addict. But at first, that's all we could do was basically just try and help him stand, help him to strengthen his muscles. I say we, again, Dr. Blake and her crew doing all of the work there. Here's a little video just showing him taking some of his first steps a couple days after pin removal. You can see just a very unsteady dog. He's just really can't get those front legs underneath him. But I was pretty pleased at that point, just with even what he was doing at that point. But again, his post-operative care, huge deal, and I give all the credit to Dr. Blake and her crew here at the hospital, and then also to Jenny and Jason and all the care that they've been doing at home. I do want to say thank you to the media for helping us tell Milo's story. My small little academic mind was just thinking about trying to document Milo's case for teaching, so I could teach students and colleagues about this condition. I had no idea that this would be, such an impactful story that has made its way across the globe. Oklahoma State has their media consultants, and their assessment, just looking at the first month after the story broke, was a potential reach of over 330 million, and that's just in the U.S. alone. But obviously, we couldn't have got that message out without the media, and so I just simply want to say thank you very much for helping us tell his story. For pet owners and other dogs similarly affected, getting the story out just helps folks learn that there is potential, there is hope for situations like this. That's pretty much what I had to say just as a presentation. I'd like to ask Jenny to come up and share the podium. Miss Jenny Hayes, and Jenny, I'll let you just take the floor, and if you want to speak to your experience with Milo here at the hospital, sure, but then also at home to help give folks an appreciation.
Sorry, God.
Thank you so much.
We just want to be able to hear you.
Thank you.
Wow, where do I start? I'm a little bit emotional watching. I'm also a crybaby, but just to see him when he first started, it's hard to think back that he was so small and so, I hate to use the word broken, but he couldn't hardly do anything. I remember whenever we got to bring him home in the full body cast, I understood that he was going to be in a full body cast. I didn't really understand how difficult that was going to be. He was a 7-week-old puppy, so I was under strict orders that he couldn't get wet at all. It was a medical emergency. I don't know how much experience you have with 7-week-old puppies, but they pee and they poop and they're messy, and he also couldn't stand. So we were either literally holding him or we had him propped up in like a big wicker basket. But I mean, only for 3 or 4 minutes at a time, because it was, God forbid, if I put him down in this basket and he pees all over his cast, then I have to rush him to Stillwater, and we live an hour away. So it was the first couple of days. There was a lot of tears on my part and on Milo's part. Although I can say that Milo handled it a lot better than I did. He never lost his spark. He has always had a lot to say. That certainly didn't change. But he's always just been honestly awe-inspiring to us and to our rescue. Specifically beyond that, the casting, had its own difficulties, and then when the cast came off, and they handed me this tiny little puppy with zero muscle mass and this book about this thick of all the things that we were supposed to do at home, and I get home and within 30 minutes I'm calling Summer and I'm like, oh my God. I can't believe that this is now my job. It was really difficult. Milo wanted to go. Milo wanted to go from the very second those things came off. Milo wanted to go when they were still on, but the second he was actually able to move his body, the challenge went from, holding him all the time to all he wanted to do was go. So he didn't have any strength, as Dr. Clary pointed out. So as he would move around, he would constantly, his legs would go outward. He had laxicity in his tendons so he couldn't, it was constantly picking him up off the floor and then wearing him out an additional injury during that whole time. I would send Dr. Clary and Dr. Summer, video updates, and it was doing really good, but hey, maybe don't let him do that. So it was quite a difficult journey trying to figure out what he could do versus what he couldn't do, and then just trying to literally hold him back for his own safety. That was pretty difficult.
And I got to say, again, Dr. Heatley, just very appreciative of just the care, how you stepped in to try and help us as well. Yeah, it's a major logistical problem having to get Milo back and forth from Luther, and so you stepped in to help quite a bit, including with some of the rechecks. Milo, we would have to take x-rays of his limbs and evaluate his bone growth, and Dr. Heatley and her crew were very good to take quality radiographs and send those up digitally, but also just helping out with the rehab care, and I'll just very much appreciate that. Sorry to interrupt, Ms.
No, that's perfect. Just on that, Dr. Heatley, she's been absolutely incredible. She was there for moral support. I've sent her hundreds of photographs and videos of, am I doing this right? Am I doing this right? Am I hurting him? So she's absolutely been completely necessary in this journey. So thank you.
Well, it's been a team effort.
Very good. Thank you.
Thanks.
All right. Thank you, Jenny. Thank you, Dr. Clary. We can open the floor for questions now, if there are any. Yes?
Is the surgery going to affect Milo's growth later on?
Excellent question. Milo is about 8.5 months of age right now by my counting. That means that his skeletal growth is pretty close to being complete. He's got maybe about 5–10% more. So far, and that's one of the things we've been assessing with these periodic radiographs, is to assess his bone growth. And so far, it's not affected, his condition's not affected the growth of his long bones. And so his limbs are very straight. But that was a definite concern on the front end, and one that we had talked about. Said, look, I feel pretty confident we can get the elbows back, but I can't tell you for sure, how well the bones are going to grow. But thankfully, he is nice and straight in his bone structure, and so I don't expect that to be a problem moving forward.
Jenny, I know that when Milo first had surgery, and Dr. Clary, you attested to this too, that there was no guarantee that Milo was going to be able to walk. So now, looking at him, being able to see him, live life like a normal dog, how has that affected you, and just kind of seeing that whole process follow through?
It's affected me deeply. Sorry. Rescue can be exceedingly difficult. Most of the time, well, I wouldn't say most of the time, but a lot of the time, we're not successful. Sometimes we do everything medically possible. It's not a lack of, try or even veterinary ability. It's just that sometimes in rescue it doesn't work. And so that's obviously the hardest thing about rescue. But watching Milo, who no one was really sure how well he was going to do, just absolutely exceed everyone's expectations, and and touched so many people. It's impacted me extraordinarily deeply. Absolutely.
Dr. Grant, 2 questions for you. First of all, how rare is it to see something like this? And then also for students here at OSU to have Milo's example going on, how's that for them and you guys?
Great questions. In terms of how common a problem this is, it's certainly very infrequent. We don't have precise numbers, partly because I think some puppies that have this condition, again, if they're not born with it, it develops shortly thereafter. It may go under the radar while they're just kind of being puppies, suckling on the mother, and they're not supposed to walk. But when all of a sudden the other puppies are walking and this one's not, then it becomes apparent. I suspect that many of those puppies, folks just assume there's nothing that can be done and maybe are euthanized. And so it's hard to get a good grasp on the actual incidence or frequency of the problem. But again, in since 92, what is that now? Almost 27 years, Milo's number 3. The cases that I see and that our colleagues see here, usually they're the more unusual cases, and so the Milos get referred here. And so with only 3 cases over 20 some odd years, that gives a good picture about how uncommon it is. In terms of its impact for the veterinary medical hospital and the students in particular, certainly it's an opportunity to educate our students, not just on Milo's condition and what can be done, but just on the importance of collaborating together with a pet owner. Again, when Jenny brought Milo in, obviously we had to kind of walk through the potential scenarios and the discussion of, well, I've had one dog that I operated on with this. That dog did very well. I can't guarantee that we'll have the same results. Well, you have to work through that discussion, and so the students, they're involved. They are in the exam room when we're talking together. They're involved in doing the exams. The students get to see collaborative care on display. The students get to see just up close and personal how these cases can be so impactful to owner and to personnel. We have many veterinary technicians and staff. Man, they'd be coming checking on Milo as often as they could. When Milo comes back for his rechecks, if I don't make the rounds with him and he gets to see the folks in radiology, anesthesiology, then I get in trouble. So people love Milo at the vet school, and that to me just kind of speaks to the personal impact of the story, but then also just the appreciation that says, you know what seemed like maybe a hopeless situation, seems to be turning out well. Do they all turn out that well? No. That's just the nature of medicine. But I think it's been a great opportunity for the students. So thank you for asking.
Are you hearing from a lot of doctors or other schools from around the country and beyond now that this has gotten so much play?
Within the first week, I was getting emails, more from pet owners, say, I think my dog's got that kind of problem. Sometimes it wasn't, sometimes it was. And so, when word like this gets out, then you start to receive calls. I've had an opportunity to talk with other surgeons as well, including colleagues who are dealing with this particular problem. Because if you go to the literature, again, as academic surgeons, we know that if we have a real unusual condition, well, we should do a literature search, see what's out there if we don't already know. And you find just a handful of cases, maybe about 12, 15, in the whole body of literature stretching all the way back to the 70s. There's just not that much out. So when you see a case like this, it's good to ask your colleagues. Here we have 2 other small animal surgeons, so we can talk together, but then also at other institutions to talk, said, hey, tell me about your experience dealing with this. So yeah, we've had calls from colleagues as well as pet owners.
Jenny, you talked about how Milo's impacted so many people's lives. Can you talk about how he impacted your life?
Yeah, he's been absolutely incredible in our life. We are a 501c3 nonprofit rescue, so typically when we get animals in, we do a lot of medical cases, a lot of special needs. They're typically up for adoption. After spending time so much time with Milo. Again, in those casts, we literally could not put him down. He went everywhere with me. We were just far too attached at that point in time. Also, Milo became such an internet sensation that it seemed we had hundreds and hundreds of applications on him, which is not normal for dogs in our care or animals in our care. So it almost seemed unwise to adopt him out for people who may want him for because he's an internet sensation, not because he's a beautiful coonhound. But he's impacted our lives personally, and then with our rescue. I mean, it's been certainly we never took him in, never expected that for a second, never expected any of this when we took him in. But he's been not only a wonderful addition to our home and our family, but also it's been really, really good for our rescue, getting the word out about us. So.
Sorry if I should know this, but was Milo brought to you, or was it one of your own dogs, or?
Oh, no. Yeah, he was an owner surrender. He was brought to us once they realized we got him when he was about.
It was just shy of 4 weeks.
He was just shy of 4 weeks. And they had just realized, Dr. Clary was saying that they had kind of just realized there was something wrong with him, because before, he was just with all the other puppies in the litter. And once he started trying to ambulate, then his, the first day that I had seen him, his paws were not completely, I don't know which way you would do it. But as time went on, Summer saw him probably 3 times, and it just kept getting worse.
Started out looking like an angular limb.
Mm-hmm.
Yeah.
I know he was so young, we waited a little bit, and then it became clear pretty quick it was more than that.
Yeah.
And the imaging, his bones weren't ossified enough to even see it on x-ray, so he needed further imaging to really determine what.
Yeah. Yeah, he had a CT, was it or an
Yeah,
MRI?
it definitely is. Dr. Heatley was saying that with puppies, when you take an x-ray, well, their bones don't show up real well, as is the case for an adult. And that's a definite challenge sometimes, trying to discern what all's going on in the limb. We have a state-of-the-art CT scanner here at the Veterinary Medical Hospital, and so within 24 hours of Milo hitting their doors, we were getting a nice CT to evaluate, in particular, the shape of the bones. Again, I knew what was going on in his elbows, but I couldn't just say for certain that his bones were properly shaped, because if they have deformity of the bones on top of the elbow problem, then that simply complicates the repair. Very good point.
Yeah, so no, he was not. That part of the story was just to say that once they realized that there was something wrong with him, they reached out for rescue. They were going to euthanize pretty much that day. I was like, no, wait, I'll take him.
So at this point, is he healed, or is there a chance he could still go back the other way?
So at this stage, Milo's elbows are not going anywhere. They're stable, and we'll bring Milo out here in a little bit. You'll get to watch him walk and all of that business. You'll notice that he doesn't quite walk like a normal dog, and the reason is for that is because his elbows, he has relatively little range of motion in his elbows, and his body is made adaptations, and so the way that he walks accounts for the fact that he doesn't have a lot of range of motion in his elbows. But his elbows are stable; they're not going anywhere. The main thing is, are the joints above and below, are they holding up, and will they continue to hold up? And certainly they're holding up well now, and I expect that'll be the case moving forward. Again, I couldn't be more pleased at this stage with his progress, and I think his prospects looking forward, I think generally are good.
Are there any other major challenges that Milo will have to face?
Well, I hear that he keeps getting in the pond, so he's kind of the troubles that puppies get into and whatever else. But in terms of a medical standpoint, he might be a little more at risk for getting arthritis in his joints above and below. That may be a potential concern. But by and large, Milo just kind of gets to be a puppy and do the puppy kinds of things and get in trouble. And
Yeah, well, that's that.
and I hear he can sing really well.
Yeah. I'm sure he'll demonstrate when he comes in here.
Any other questions? All right.